full-time and their employer doesn't offer them insurance, or they offer them insurance where the worker has to pay half of the premiums or more out of their own pocket. And that's, for a family, we could be talking about $6,000, $7,000, $8,000 a year. And if you're at minimum wage, maybe a little above that, you can't afford that.
Mm-hmm.
So the system of employer-based coverage needs to be bolstered. We don't want to wipe it out. It's a good system. We want to help it exist and thrive. But we also want to make sure there's other options for people as well.
Mm-hmm. How do we relate health care to bankruptcy?
Well, that's a good point. What happens to people even people who have insurance, is that they find that they have covered, their benefits aren't covered, or there are limits on how much is covered, and they end up with very high medical bills. Certainly the uninsured, but definitely also people with insurance. In Texas, 5.6 million people, just in the state of Texas, spend more than 10% of their pre-tax income on health care costs, and many of those have insurance. So there's medical bills you can't afford to pay, you struggle, you pay as much as you can. You know, the uninsured actually pay about a third of their medical bills out of pocket.
Mm-hmm.
But they get into trouble and they end up with medical debt that's on credit cards. Hospitals now have credit cards that they offer you. Oh, worried about how you're going to pay that medical bill? Here's a credit card you can apply for. Well, you know what happens with those interest rates. We're trying to regulate the credit card industry
Mm-hmm.
a bit, but those interest rates can go sky high, and the next thing you know, a person's in trouble. They miss a mortgage payment, and they end up in bankruptcy. One of the primary reasons why families end up in personal bankruptcy is that medical debt issue.
Mm-hmm. About 10 years ago, it was said that every person who is insured takes care of their own insurance, and 4 other people. Has it gotten to be 5 or 6 other people now that when you pay into the system, it's spread over people that don't have coverage?
That's right. That's that hidden health tax concept. Families USA, my organization, just did a report. It came out about a month ago, and we quantified that. What happens is when an uninsured person goes to the hospital, they pay a third of the bills out of their own pocket, often at tremendous sacrifice. You know, they may have to really cut on other vital things in their family budget. So that leaves 2/3 of that bill not paid for. There's some charity care, some government programs that pick up about another third of that. Well, you've got a third left over.
Mm-hmm.
And something has to happen to that. Hospitals and doctors can't provide free care and continue to be in business. So that cost is shifted over to the rates that hospitals and doctors charge insurance companies for health care services. And of course, an insurance company isn't just going to eat that cost, so they pass it on to those of us who have insurance through higher premiums.
Mm-hmm.
So that cost shift through that system is what I call a hidden health tax. You and I, because we have insurance, probably pay about $1,000 more a year because there are uninsured people in our system that get very sick and have to get care. Now, I also have to point out that a lot of people who don't have insurance end up delaying or actually foregoing care. We know in this country, millions of people die every year because they don't have insurance. That's real. That's not a statistic that's unfounded. That comes from the Institute of Medicine here in Washington, D.C. So people die because they don't have insurance, and sometimes because they were worried what will happen to their kids if they don't get to the doctor. They go, they get the care, they pay what they can, and we all pay the rest.
Mm-hmm.
What a crazy healthcare system.
You know, every day we're working on the healthcare reform package, and the House has a different bill coming out than the Senate. But I still have not been able to figure out what do we do with so many non-citizens that go to the emergency rooms because they don't have health insurance. Any word in the bill on that population?
Well, that's such a tough and difficult issue. First of all, when we talk about the numbers of uninsured, I want to point out that those numbers that we hear, there are 47 to 50 million uninsured, If you count them different ways, the number's even higher. That probably isn't counting people who are undocumented immigrants. Because if you get a call from the government and they say, what kind of insurance do you have, and you're undocumented, you're probably not going to answer that survey. You might hang up the phone if you have a phone. So that problem that we say 47 million doesn't even count the issue around undocumented immigrants. There's a bit of confusion. There's immigrants who are here in the country legally. They're documented. They have papers. They pay taxes, and they work. And I think for those folks, we ought to extend the right to purchase insurance and be part of our system. Undocumented immigrants is where it becomes much more difficult. They are here in the country illegally, and we have to think about what we want to do in terms of giving them pathways to citizenship and whether we want to provide some source of funding for their health care as well. I think the House is probably more likely to address that tough issue than the Senate. There's a lot of backlash out there among the public about spending money to help those people who may actually be our neighbors and friends but who are undocumented. A very tough issue.
It's a tough issue for my area. And I've listened to the commentary, and all of it is for the American people. And I know that we have a tremendous number of people that are not citizens in our border states, period. California, Texas, Arizona, Florida, and some New York. And when we get this great reform that we're attempting to make affordable and accessible for all people, well, all Americans, we still have a huge number of people that are here but don't have coverage. And I know that our hospital, Parkland, had $300-some million of uncompensated care last year. And I just wonder if there's, I haven't seen any thought being given to that in either one of the bills.
Tough issue. I think, for me personally, when I see a child or I see a mother, I see someone working hard, doing a job that maybe a lot of us wouldn't be willing to do, I don't want to ask, how did they end up in this country and what's their legal status? I want to make sure they're treated with humanity, with compassion, and that we provide the basic necessities for that person. I think for the American people, this is a very tough issue. And there is now a real backlash against immigrants across the board. It's ugly, isn't it? And,
it is.
And I think we have to consider hospitals that will open their doors to whoever needs health care, who understand their code of ethics is to treat people who present, and provide sources of funding to help those hospitals that are willing to care for those that perhaps others in our country would not care for.
The American public has cried out for health care reform, but I still wonder when we get to the details, what is being demanded. You have any idea what the majority of Americans want?
Well, the polling work, the research on focus groups all say that Americans want to see some relief from high health care costs and high health insurance premiums. There's no question. There's also a strong sense of moral obligation to the uninsured. There's also a sense of that's an issue that hits me in the pocketbook. And we talked a bit about the hidden health tax. So the public wants health care reform. They want all of the things that we're seeing come together. If you look at the major elements of both the House bill and the Senate bills, we're all on the same page, Republicans and Democrats. There are a few tough issues. But what's happening is I think people are being scared. And they're being deliberately scared by those who just want to say no, no, no to everything for whatever motivation they have. And frankly, I believe many of those motivations are not in the best interest of Americans. They're in the best interest of politics. And I don't have patience with that, and I bet you don't either.